Good day, Leforans. Welcome to MindWeb Academy. So this is your head coach, Mr. Jikar C. Magbanwa. So for our topic this afternoon, understanding the pathophysiology of your acute respiratory distress syndrome. Why do we need to understand pathophysiology? The beauty of your pathophysiology nurses is that you'll be able to identify the physical and the psychological effects of your disease process. What do I mean by that? By understanding the pathophysiology, you'll be able to understand your signs and symptoms. And by expecting the signs and symptoms of your disease process, the signs and symptoms will serve as your guide to develop individualized nursing care plan. All right, I'll give you an example. If the disease process one of the clinical manifestation is constipation, then you don't need to memorize, right? Okay, what should be your possible nursing management? Do I need to increase the fluid intake or decrease fluid intake? Obviously, I have to increase the fluid intake because you have what? You have your constipation. What about the diet? You don't need to memorize. The diet should be high in fiber. So that's the beauty of your what? Of your pathophysiology. If you understand your pathophysiology, then you will understand also your signs and symptoms. And in NCLEX, your signs and symptoms most of the time is being asked, especially for the test format, select all that apply. All right, so before I start, with our discussion, I want to know first your location. Okay, so comment down your location. Okay, for those, nurses from Dubai, do you have nurses from Dubai? Okay, what about nurses from Oman? Okay, what about nurses from Kingdom of Saudi Arabia? Okay, what about nurses from Singapore? Okay, so thank you so much for your participation. Okay, what about, from Metro Manila? Do we have nurses from Metro Manila? Okay, what about from the Visayas, Bacolod, Iloilo? Do we have nurses from Cebu? What about Davao? Okay. What about Cagayan de Oro? Okay, so welcome to MindWeb Academy. So again, for your location, you can comment your question. Okay. Do you have nurses from London? Okay. What about from the United States of America? Okay. Laguna? Okay. Pampanga? Do you have nurses from Pampanga? Okay. So thank you so much for your participation, and I hope we will able to understand the pathophysiology of your acute respiratory distress syndrome. All right. Why ARDS? Because ARDS right now is one of the most common cause of death because of what is happening this time, and that's the most common cause of death because of your viral infection. Okay, so that's very timely and very relevant to what is happening right now. Okay, what about, again, let's go back to your location. Okay, what about nurses from Lawag? Okay, what about nurses from Tuguegarao? Okay, so thank you so much for your participation. Okay, so I think I have to announce now. Okay, let's have a game, nurses. Okay, the first 3 participants who will give the right answer will be given 2,000 pesos discount when you enroll to our actual digital program. Okay, so that's 2,000 discount for your Okay, for the actual review program. Okay, so do we need to start our topic or the question and answer? So again, the top three. Okay, so the first three participants who will get the correct answer will have, of course, a discount of 2,000 when you enroll to our actual digital review program. Okay, so nurses, are you ready? Okay, do we need to start our question and answer? For Marco, do we need to start now? Okay, so we will start now your question number 1. So again, okay, paunahan po tayo. But take note, you have to analyze and integrate critical thinking. All right? Okay, because this is the NCLEX related topic. Okay, so for your question number 1. Okay, question number 1. For your question number 1, Nurse Webby is caring for a client with acute respiratory distress syndrome, or your ARDS. She understands that the main problem or problems is are select all that apply. Letter number 1, mediastinal shift to the unaffected side. Okay, number 2, you have your atelectasis. Number 3, you have your sharp pleuritic pain. Number 4, that's nagging cough. And number 5, you have your persistent hoarseness of your voice. Number 6, you have your pulmonary edema. Is that a manifestation of your ARDS? Or your number 7, paradoxical breathing. So again, the question is under your content. Okay, content area is physiologic integrity. And then the test format is select all that apply. Okay, so again, your keyword is acute respiratory distress syndrome. The main problem or problems is are select all that apply. Okay, what should be your best answer? Should I include mediastinal shift? Okay, should I include atelectasis? Go back to your nursing, okay, review before. Okay, what about your, okay, sharp pleuritic pain? Should I include that in ARDS? Okay, what about nagging cough? Then you also have your persistent, okay, hoarseness of your voice. Should I include that in your ARDS? Okay, pulmonary edema and your paradoxical, okay, breathing. Okay, so we have 1, okay, who got the correct answer. We need 2 more, okay, 2 more. Okay, so the first one, congratulations. Okay, if you're going to enroll to our actual review program, okay, you'll get, okay, a discount of 2,000, okay, pesos. Okay, so we need 2 more. Okay, so you have select all that apply. Should I include number 1 to number 7? Do I only have to include 1 and 2? 3, 4, 5, 6, 7? Okay, so that's your select all that apply. Okay, comment on your answer, nurses. $2,000 discount, yes. You'll get 2,000 discount. Okay, so for the first one who got the correct answer, you'll get 2,000 discount. Okay. So we need 2 more. Okay, so the second one, okay, and the third one will also get a discount of 2,000 pesos. Come on, nurses, you can do that. Your focus should be the main problem. or problems of your, ARDS, or acute respiratory distress syndrome. Okay. Mahirap ba? Okay. So we have the first one who got the correct answer. What about the second one? Okay, nurses from Manila, from the Philippines. You should know that. Okay, nurses from, Saudi Arabia, from Dubai. Okay. Magagaling itong mga nurses natin eh. Lalo na mga taga-Lefora, obviously. Okay, do we have the second one? Okay, so we need one more. Okay, congratulations for the first two who got the correct answer. Okay, ang galing. Thank you so much for your participation. You can share this one to your friends. Okay, you can tag your friends so that they can also understand, okay, the pathophysiology of your ARDS. Okay, so we need one more. Okay. Sino kaya yung third natin na mananalo ng 2,000 discount? Okay, so we only have two who got the correct answer, right? Okay, so congratulations for the first two who got the correct answer. So for the benefit of time, let me now discuss, okay, before I'll give you the correct answer in MindWeb, I still have to discuss, of course, what is really your ARDS. Okay, so we define ARDS, nurses, as your acute respiratory distress syndrome. Okay, previously known as your adult, respiratory distress syndrome, adult. But this time, both children and adults are now being affected by your ARDS. So that's why the term you have your acute respiratory distress syndrome. All right. Some experts may also call this one a short, HPPE. What do you mean by your HPPE? That's the other term also for your ARDS. And that will actually explain, the pathophysiology of your ARDS. It's your what? Hyperpermeable pulmonary edema. All right? Okay, so that is your, other term that will explain, the pathophysiology of your ARDS. Okay, but the pulmonary edema in your ARDS nurses is non-cardiogenic. Ibig sabihin po, there is no problem in the contractility of the heart. There is congestion in the lungs kasi yung problema natin doon mismo sa lungs ng client natin. All right? Okay. So let me now proceed. Before I'll proceed to the pathophysiology, let me now discuss what are the causes. Okay, the causes of your acute respiratory distress syndrome. Okay, there are many causes, nurses, of your acute respiratory distress syndrome. One that I can give you is short, aspiration of your gastric contents. All right. The other one can be reaction to your drugs and your toxins. The other one can be metabolic, in nature. One best example is your, DKA, or your diabetic ketoacidosis. All right. Then the other one, of course, is your, infectious process, which is common right now, just like your viral pneumonia. All right. Okay, so I have your viral pneumonia. Okay. Why do I have to focus more on your viral pneumonia? Because viral pneumonia is one common cause of death. Okay. And the common cause of death because of viral pneumonia, mapupunta kasi siya sa acute respiratory distress syndrome. You will understand that later. Okay? So we have now defined what is your other term for your ARDS, and I have identified also the causes. What are the possible causes? And I will focus more on your what? Viral pneumonia. Okay, so before I'll discuss the pathophysiology of your ARDS. Okay, it would be better for us again to understand first what is your gas exchange, and that is actually part of your anatomy and your physiology. In MindWeb, before we discuss the pathophysiology, we need to understand and review first your anatomy and physiology para mas mabilis natin maintindihan ang disease process. Okay? Sige. So we'll be discussing this time part of your ARDS, understanding the pathophysiology, is for us to discuss what is really your gas exchange. Okay, nurses, this is very basic, but we need to understand this, para maintindihan natin ang acute respiratory distress syndrome. Okay, when you say gas exchange, we are talking about your ventilation and your perfusion, or your VQ ratio. Okay, so the ventilation and your perfusion. What do I mean by ventilation? Ventilation is the inhalation of oxygen na napupunta sa alveolus natin. So we will be talking about, and we will be using your mind mapping technique in gas exchange. So in ventilation, this is your alveolus, because single lang siya. Pag madami, that is your alveoli. Tama po ba? All right. Remember, nurses, that this is the heart. Okay, the four chambers of the heart. This is the right atrium, and the right ventricle. Okay, if you can still remember, nurses, the right atrium contains oxygenated or unoxygenated blood. Yes, unoxygenated. Okay, then it will go down to the right ventricle as unoxygenated pa rin. Tama po ba? All right. Then next, you have the pulmonary artery. Pag sinabi natin artery, malaki siyang blood vessel. So artery, then pulmonary arterioles, and then you have your what? Pulmonary capillaries. Paliit ng paliit yung blood vessel natin. Hanggang po, mapunta siya dito sa, alveolus natin. So kada alveolus, meron siyang tinatawag na capillary or blood supply. Okay, so the ventilation here is the oxygen that enters your lungs, and until, mapunta siya sa alveolus natin. Did you get my point? Okay, then, from the right side of the heart, di ba po, sabi ko, you have the unoxygenated blood. And napunta na siya sa pulmonary capillary. Meron ba siyang oxygen kasi unoxygenated, or carbon dioxide? Very good. It's carbon dioxide. Okay? This is what you call the ventilation perfusion ratio. Okay? Or balance. And that is what you call the gas exchange. All right. So once oxygen is inside the alveolus and blood contains now high amount of your carbon dioxide, diffusion, will going to happen. Magkakaroon ng tinatawag na diffusion. How do we define diffusion po? Diffusion is, the transportation of carbon dioxide from higher concentration to lower concentration. Saan mas madaming carbon dioxide? Sa blood. So it will diffuse from higher to lower. So mapupunta si carbon dioxide sa alveolus. Tama po ba? Saan madaming oxygen? Sa alveolus, right? Okay. Oxygen will diffuse from higher to lower concentration. So dito mapupunta si oxygen. So this time the blood is oxygenated. Tama po ba? Once oxygenated, babalik na po, ang oxygenated blood sa left side of the heart, ipump na siya sa systemic circulation. You call that one as your gas exchange. Okay, you might ask me, sir, why do you have to discuss the gas exchange? That's very important. Why? Later in your ARDS, there is what you call pulmonary edema. When you say pulmonary edema, the fluids from the blood vessel or capillaries will go here. Mapupunta siya dito. Kasi nag-increase ang capillary permeability. Pag may tubig po sa gitna ng alveolus and your capillaries, possible kaya na yung mga gas natin magdi-diffuse. Hindi pwede. So tawag natin dyan, it's the impaired gas exchange. Did you get my point? Okay. There are 4 basic types of your ventilation perfusion ratio. Okay, so let me discuss what are the types of your ventilation perfusion ratio. Because we will going to apply that later in your pathophysiology. Okay, nurses, the first type of your ventilation perfusion ratio is the normal, the normal VQ. When you say normal VQ, nurses, I'm going to use the mind mapping technique na lang para mas maintindihan natin. This is your normal VQ. In normal VQ, this is your alveolus. This is the capillary. Okay. I was able to explain kanina na merong oxygen dito. And dito naman merong carbon dioxide. So in normal ventilation and perfusion, may pumapasok na oxygen sa alveolus and maganda din ang blood flow natin. Okay, sa capillaries. So may gas exchange na possible. Okay, so that is what you call the normal ventilation perfusion ratio. And that is 1:1 proportion. So normal to. Kasi walang, possible ang gas exchange. All right. The second one is what you call your, high, ventilation versus your perfusion ratio. Okay. When you say, nurses, high ventilation, perfusion ratio, dumami ang oxygenation natin. Tama po ba? So if I'm going to represent that, ito yung nangyari. Maganda po ang oxygenation sa alveolus natin. Pero ang perfusion naman natin is low. So we have high ventilation, low perfusion. So this is what will going to happen. Bakit kaya konti ang blood flow natin sa capillaries? Okay. Kasi baka may obstruction dito. Okay. So what will gonna happen here is that the blood from here could not enter papunta dito. Okay? So the blood is obstructed. Walang napuntang carbon dioxide dito, for possible gas exchange. Did you get my point? Okay, so again, you have the high ventilation, madami ang ventilation natin, but the ventilation exceeds the perfusion. Okay, so walang carbon dioxide or blood flow na napupunta sa kada alveolus natin. Tama po ba? Kasi merong dito, merong obstruction. If this is the case, you call this one as shunting or your, silent. Is that the silent type of your VQ imbalances? Or this is what you call your, obstructive type or the dead space. What is this? Okay, so if you have high ventilation, low perfusion, gas exchange is not possible. So you call this one as your dead space. Okay, so remember that. So the first one is normal, 1:1 ratio. And then if you have if the ventilation exceeds your perfusion, walang napupuntang blood sa alveolus, so hindi possible ang gas exchange. Nagkaroon ng dead space. All right, the third one, nurses. Okay, before I proceed to number 3, what possible condition may contribute or may lead to your dead space? Kasi may obstruction dito. Okay, should I include atelectasis? No. Kasi in atelectasis, collapse of the lungs Tama po ba? But in your dead space, ang problema natin nasa blood flow. So atelectasis or pulmonary embolism. Yes, very good. Pulmonary embolism. Because the obstruction here can be your embolus. Hindi siya pumasok saan? Papunta dito. So walang possible na gas exchange. You call that one as what? It's your dead space. Okay? So the third one, Remember that in your NCLEX. That's very important. Okay, topic that you need to understand to analyze and integrate your critical thinking. All right, number three. Number three here, okay, ventilation perfusion, okay, ratio, okay, is what you call your low ventilation, high perfusion. Okay, sige nga, try natin mag-mind mapping technique. Kayo nga mag-mind mapping. Low ventilation, kukonte ang pumapasok. Okay, bakit kaya kukonte pumapasok na oxygen sa alveolus? Possible ba, nurses, na sira ang alveolus or nag-collapse siya? Yes, possible nag-collapse. Gumano na siya. Okay, so collapse ang alveolus natin. Walang pumasok na oxygen. Pero maganda ang perfusion natin. Okay, meron tayong ano dito, carbon dioxide. May gas exchange ba na nangyari? Wala. The blood flow bypasses the empty alveolus. And you call this one as your shunt. Okay, you call this one as your shunt. Or your, okay, shunting producing disorder. Okay, so your shunts, okay, kasi low, walang ventilation, pero maganda ang perfusion natin. Okay, where can I expect shunt? Okay, if you'll be given a question in your NCLEX, is it common in atelectasis or common in pulmonary embolism? Ang shunt natin, atelectasis. Kasi ito ang problema eh, di ba po? Or alveolus. Pero maganda naman ang ano mo, ang blood supply. That is atelectasis. Okay, so this time, you know your VQ, okay, ratio. Okay, the last one, okay, is what you call your low. Okay, number 4. Okay, have your low ventilation, low perfusion. Okay, so how do I do the mind mapping technique? Okay, so collapse lungs. Okay, nag-collapse na lungs natin. And may problema din dito sa blood supply natin. So, walang oxygen, walang carbon dioxide. What do you call that? Ventilation perfusion ratio. Anong tawag natin doon? Is that the shunt? Okay? Or dead space? Okay. You call that one, nurses, as your silent. Okay? The silent ventilation perfusion ratio. Okay? So ilan na lahat? Normal, you have the dead space, you have the shunt, and then you have your silent. Okay? Saan makikita si shunt? Pag sinabi shunt, isipin mo lagi, collapse ang blood vessel, pero madaming perfusion, kaya nag-shunt na lang siya. Okay, lumayo na lang yung blood vessel, it bypasses the alveolus sa atelectasis. Pag pulmonary embolism naman, low ang perfusion mo, maganda ang ventilation, then you have your dead space. This one, dalawa. So you call that one a sure silent. Okay? So that is sure. Okay. Ventilation, perfusion, okay, ratio and imbalances. Okay. Let me now proceed to your pathophysiology. So this time, nurses, this will answer question number 1. Okay? And this will also answer your common question why viral pneumonia or your viral infection can lead to acute respiratory distress syndrome and eventually death of your client. Okay? So again, I'll start with your viral pneumonia or your viral infection. Okay, I'm gonna make use of the schematic diagram to better understand your pathophysiology. Remember, nurses, in viral infection or in any type of infection, there will always be initiation. Okay, you will have your initiation of immune and inflammatory process. Okay, so there will be initiation of your immune and inflammatory process. What will happen if there is no initiation of the immune and inflammatory response? Okay, two things are going to happen. There will be release of your vasoactive substance. Okay, so you'll have your release of your vasoactive substance. The other one, okay, pathogenic microorganism also is capable of producing your toxic products. Okay, have your toxic products or your toxins, and you also have your proteolytic enzyme. Okay, so dalawa ang magiging pathway natin. Okay, let's start with this pathway. The vasoactive substance nurses will increase your capillary permeability. Okay, mag-i-increase ang capillary permeability. When I say increase of your capillary permeability, okay, the fluid, isipin nyo yung kanina, ito. Okay, pag increase ang capillary permeability natin, the fluid from here, okay, together with your proteins and blood cells, will go out to the interstitium or the interstitial area. So meron ng tubig dito. Meron na rin mga blood cells and your proteins. Okay, so increase in capillary permeability by nurses can lead to pulmonary edema. Yes, okay, so increased capillary permeability can lead, ito kasi, lumabas na yung tubig. Tama po? Because of what? Increase in capillary permeability. So you'll have now your pulmonary edema. So you get now the first answer, right? Okay, so what is your first answer? The main problem is pulmonary edema. But we are not yet done. Okay, from pulmonary edema, possible ba ang gas exchange? Kahit may carbon dioxide dito, tsaka oxygen. May tubig dito sa gitna. Pwede ba mag-diffuse si carbon dioxide papunta doon, tsaka si oxygen? Kasi meron tubig sa gitna nila, may barrier, hindi pwede. So what is your nursing diagnosis then? It's what? Impaired gas exchange. That's the reason bakit kanina po nag-explain ako ng ano ba talaga ang impaired gas exchange, right? Okay. The impaired gas exchange ba nurses, wala kasi pumupunta na oxygen sa blood. So mayroon bang tissue oxygenation? No. So there will be what you call your, okay, hypoxemia. Okay, so there will be what you call your hypoxemia. Okay, so this is one common cause of death of your client because of what? The cascading. Okay, you have the immune inflammatory response. Okay, then next, let's go here. Other effect of initiation of immune inflammatory is, of course, there is now, okay, when you say proteolytic enzyme, it can destroy the tissue, right? Okay, so if you have destruction of your tissue, okay, there will be destruction of your vasculature.
Pag sinabi natin nurses, proteolytic enzyme, kumbaga, tinutunaw yung blood vessel. Okay? So, nagkaroon ng damage of your vasculature or the blood vessel, the pulmonary capillaries. Pag sira na po ang pulmonary capillaries, ito, sira na siya. Okay? May gas pa ba na pupunta? Wala na. Wala na din. Tama po? Okay. So there will be decrease perfusion. Okay, so decrease perfusion na tayo kasi sira na ang blood vessel. Okay, the next, you have now increase in capillary permeability. Diba ang fluid natin kanina lumabas? Okay? Lumabas siya. The lumabas of fluid, okay, sa interstitial space, okay, you call that one as your alveolar flooding. Nagkaroon ng tubig.
Lang tissue natin. Okay. So this fluid, we call that one as your, okay, alveolar flooding. The alveolar flooding can cause loss of your surfactant. Okay? The loss of your surfactant can lead to collapse of the lungs. Tama po? All right. So there will be collapse of the lungs. So you call that one as your atelectasis. Okay. Tama po? Tama. Okay, kasi napunta sa diat ang tubig dito eh. So nag-overflooding. And then nawalan siya ng surfactant, so nag-collapse na siya. Tama? Okay. Pag atelectasis, ano po ang ventilation natin? Decrease ventilation. Okay. If you will be asked in the exam, in your actual NCLEX, what is the most common ventilation perfusion imbalance in client with ARDS secondary to viral infection? Ano yung ano na yun? Is it the shunt, the dead space, or the silent? Silent, right? Okay, so because what? Decreased ventilation, decreased perfusion. So what are your two main problems? Atelectasis and your what? Pulmonary edema. Okay, I did mention, bakit kailangan ko, sir, pag-aralan yung patho? Not really to memorize, but to understand the pathophysiology. Why? Tingnan nyo, oh, may hypoxemia ka na. Okay, anong gagawin ng nurse pag may hypoxemia? You don't need to memorize. Do we need to increase the oxygen of your client? Yes, you need supplemental oxygen. And most of the time in the ICU, you need what? Assisted ventilation. Okay? So you need a ventilator. Okay. So that is common nowadays. Because of what? Because of the viral infection that lead to your hypoxemia. Okay. What else do you need? Okay, to answer the atelectasis, do we want to reinflate the lungs? Yes. We need, of course, sure. Okay. Positive and expiratory pressure. This is to open the airway and to reinflate the alveolus or the lungs. Okay? So that's why you can answer your atelectasis, and we have also answered your hypoxemia. That's the beauty of your what? Pathophysiology. Okay, if you do understand this, nakuha mo na yung signs and symptoms, alam mo na kaagad ang possible na management. Okay? So I hope you have learned something from our discussion. Okay, for those who got the correct answer, you will have your 2,000 discount if you enroll in our actual review program. Our actual review program is divided into 3 phases. Okay, but before actually mag-proceed tayo sa first phase, which is the refresher, we will give you the diagnostic test. Okay, to identify your weakness and your strength. Para may baseline data kami. The student support is very supportive and they are ready to answer all your questions. And they are, okay, you have the automated, pagkatapos ng diagnostic test mo, automated, you have your results. So makita mo na kaagad saan ka, okay, weak and saan ang strength mo. Then, pagkatapos ng assessment natin, you'll proceed to the refresher. The refresher course, okay, is good, especially for those na malapit na yung ATP nila, malapit na yung exam nila, or those na malayo pa yung exam, okay, and they want to prepare more kasi matagal na sila wala sa nursing field, nawala na sila. Okay, so beneficial so for both na, okay, malapit na ang exam and doon sa, okay, malayo-layo pa kasi you still have time, okay? So the refresher, okay, you will have now disorders per system, and since we are following the test plan, we were able to include in the refresher phase your delegation, the prioritization, and your assessment. Okay, all topics are being discussed here according to your test plan. Okay, then you have now the foundation, the refresher. Proceed to the intensive. This is now the application. The intensive phase of our program is a computer adaptive test na po. It mimics the actual NCLEX na. So each question, okay, you will pick the question, and we are also following the test format, the single response, the select all that apply, okay, and also arrange in chronological order. All right. Okay, and then the after application, okay, specialized nursing topic. Okay, kasi pag sinabi natin specialized nursing topic, hindi ko muna isiningit doon sa refresher kasi basic eh, dapat foundation muna. Para mas maintindihan mo na ang third phase, which is the booster, the specialized okay, topic, the ABG analysis, you have the ECG tracing. Okay, so you are now okay, ready to understand the topic in your booster phase. And after this, you can still avail of our counseling. We still have the final coaching, and we also have the enhancement exam. Then you have the predictor exam. The predictor exam, for term predict. Okay, most of the time, those who prepared ng mas maaga and natapos nila 100% ang program, yun din po ang pumapasa sa NCLEX. Because NCLEX is a matter of preparation and understanding, integrating, critical thinking and analysis. Okay? So I hope, you were able to answer question number 1, which is of course your pulmonary edema and your atelectasis. Okay, basing from what? Our pathophysiology. Okay, if you answered mediastinal shift, that is for your pneumothorax. If you answered, sharp pleuritic pain, that is your pulmonary embolism. Okay, for the nagging cough, that's for your bronchogenic CA. And pag lagi ka namamaos, persistent hoarseness of the voice, that's laryngeal cancer. Okay, and your paradoxical, breathing. When you say paradoxical, every time you inhale, the chest is inward. Okay, and then if you expire naman, your expiration, outward naman siya. That's why paradoxical. And this is common in flail of your flail chest. Okay, so your answer should be, atelectasis, number 2, and number 6, which is your pulmonary edema. Okay, so thank you so much, Leforance, for the time. Okay, and I hope you have learned something from the discussion. See you in our actual digital, NCLEX program. This is Mindworld Academy. We think possible. And our promise is retention through simplification. Thank you so much.